The check for breathing and pulse should take at least 5, but no more than 10 seconds. If you observe no breathing, abnormal breathing, or only gasping, and you do not definitely feel a pulse, ensure that help is on the way, and start chest compressions immediately. In this practice session, you will first check for scene safety. When the scene is safe, approach the victim and tap and shout to determine responsiveness. If the victim does not respond, yell for nearby help and check for breathing and a pulse. If there is no breathing or only gasping and no pulse, ensure that help and an AED are on the way and immediately begin CPR, starting with chest compressions.
We'll pause here before we practice checking for scene safety, responsiveness, breathing, and pulse. So position yourself to the side of your mannequin to practice. The instructor can begin when everyone's ready.
Are you ready? So count with us.
So let's begin. We'll start in 3, 2, 1.
So you look around, make sure that there's
Hey,
nothing
are you
behind
okay?
you.
Are you okay? Help! Someone help!
Yell for help.
Help!
I know.
Oh, definitely get me.
So then you would take and find your carotid, check for breathing, and then you would yell for help for the AED, if there is an AED. I know it sounds silly, but. Oh, this smart board hates me. So now it's going to start on compression instruction.
Now let's practice chest compressions. Before we start, you need to make sure the victim is on a firm, flat surface, lying face up. If you need to remove any clothing from the front of the victim's chest, do it quickly.
A bit later in this course, we'll talk about what to do if someone is unresponsive, not breathing, but does have a pulse. But right now, we're assuming you don't feel a pulse, so compressions are needed.
By starting compressions, you are initiating the CAB sequence, or compressions, airway, and breathing sequence. In the first few minutes of sudden cardiac arrest, victims will have oxygen remaining in their bloodstream. So starting CPR with chest compressions can pump that oxygenated blood to the victim's brain and heart. After you give compressions, open the victim's airway and deliver breaths. It's important to minimize interruptions in chest compressions to less than 10 seconds. Each time you stop compressions, the blood flow to the heart and brain decreases significantly. Once you resume compressions, it takes several compressions to increase blood flow to the heart and brain back to the same levels. So any interruption in chest compressions can result in low blood flow and minimize the chance of ROSC. You'll need to work with a bare chest, and later you'll attach the AED pads to bare skin.
To begin, place the heel of one hand on the center of your mannequin's bare chest, over the lower half of the breastbone. Place the heel of your other hand on top of the first. Make sure that your shoulders are directly over your hands with your elbows straight. And when we start, remember to push straight down on the breastbone to get adequate depth. When you push, push hard and fast.
You can follow along with what's on the screen as you perform the compressions yourself. You'll perform 3 sets of 30 compressions.
And remember, we'll be performing compressions at a rate between 100 and 120 per minute while counting them out loud, making sure the compressions are at least 2 inches or at least 5 centimeters deep, and allowing the chest to recoil between each compression. We'll pause here to give everyone time to get into position.
So you'll have to stand up, and then I do it like that. You want to go a little bit above that little notch, because that's the xiphoid process, and you don't want to break it. So you go up just to here.
Yep, this is uncomfortable for my hands.
Well, what would you rather do?
I don't know. Just
Let them die? Yeah, but, so, more than likely your person's actually going to be on the ground. So you're not going to have a nice table, and you can do it on the ground, but that's easier, because sometimes when we're short, you can't straighten your shoulders as much. But when you do it, you want the pressure in like the palm of your hand. You want to make sure and bring that back up so the chest recoils up.
Okay.
And some people, you know, doing this try one hand or the other. Because usually one of them's more comfortable than the other.
Let me go down wait just a second. I'm gonna go on the floor too.
Okay, that's fine.
Me too.
Yep, so then make sure that you're up over them, so your shoulders are straight. Good. And then you'd go just up here. Because remember, right there's your side leg press. Okay, start the video, and then you'll count along with it. 100 in a minute, it makes you tired.
I know, I did like 5 and I'm just like, jeez.
Just imagine if you have to do it for 20 minutes before
Get
help
ready.
arrives.
Here we go. In 3, 2, 1.
One, two, three, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
So you stop, because that's when
31.
we'll incorporate the breath.
2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28,
Good.
29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
So that was a minute. Imagine doing that for 20.
Oh my wrists hurt. Is there a different technique that we can do?
Do you know one?
You just.
Your adrenaline would be going so much that you wouldn't even think about your wrist.
Yeah.
And you're a massage therapist, they should be strong.
My thumbs are, my wrists aren't.
I think it's different practicing than actually doing it.
Correct. I mean, you wouldn't even
You
think
won't think
about it
about
because
it.
your adrenaline
Am I
is
going
so.
deep enough?
Yeah.
I feel like, God, that would like kill them.
But most of the time, if you're doing CPR, you're gonna break some ribs. But again, doing something is better than doing nothing, because otherwise they would die.
Me just pressing right there hurts.
Well, I mean, your sternum isn't somewhere that you normally press on. It's a bone. So you have
Oh,
to-
it's right here. I realized down here.
Then you break your.
I was down here. It was stomach area.
You weren't doing it there. And that's your sternum.
I know. I was like, God, we're just.
But again, they're already, their heart's not beating, so they're essentially dead right now. So we're not gonna feel it until later.
So now, let's go through some instruction on the pocket mask.
You can
And
leave your
then we'll
dummy down
practice
there and.
one rescuer skills with compressions and breaths.
When you're working, you'll likely have access to a bag mask device.
And those were all.
However, because a cardiac arrest can happen anywhere at any time, it's important to be comfortable and effective
If you want to
with the
think
use of a
again.
pocket mask.
Here we saw an example of
Oh,
it. A bag mask device might
Amber,
not be
you
too
should watch
far
the video,
away,
please.
but when minutes and seconds matter, the time saved by being proficient with the pocket mask is invaluable.
We'll be using the pocket mask for one rescue activity in our training today.
When the guard finishes a cycle of compressions, he quickly places the mask with the one-way valve on the victim's face. He delivers 2 breaths and returns to giving compressions immediately to minimize interruptions in chest compressions to less than 10 seconds.
Now let's examine the technique more closely. Place the mask on the victim's face, using the bridge of the nose as a guide for correct position.
And we
Seal
will
the
have
mask
time to
against
practice
the
right after
face
this.
by placing the index finger and the thumb of your hand closest to the top of the victim's head, along the edge of the mask. Now place the thumb of your other hand along the lower edge of the mask. Then, place the fingers of that hand under the bony part of the victim's lower jaw, near the chin, taking care to avoid the soft tissue under the chin. After that, open the airway by using the head tilt chin lift. By lifting the jaw to bring the chin forward, you'll lift the victim's tongue away from the back of the throat, relieving a possible airway obstruction.
Then press the mask down while lifting the jaw to hold the mask tightly against the face and give 2 breaths while watching for chest rise. Actually seeing the chest rise with each breath is the best way to ensure that your breaths are effective. Breaths should be delivered over 1 second each with just enough force to produce visible chest rise. Rescuers should avoid excessive ventilation. pause about 1 second between each breath.
In this practice session, you want to hold the mask firmly against the face while lifting the jaw. Also, watch for the chest rise as you deliver each breath over 1 second.
We'll pause here for you to get into position with the mannequins to practice the technique of opening the airway and giving breaths.
If you'd like to move your mannequin back to the table for the breath part, you can. You might be a little more comfortable. So the one thing, because these are dummies, there's a couple of the masks that don't quite seal as much, so you seem to have to give a little bit bigger breath just to watch your chest rise.
This way.
Mm-hmm.
Oh, cool.
So then you would do that and then try and do one breath before we start, just because sometimes they're not straight. The airway isn't, because of how we put the lungs in. Did anyone's rise? Yours did. Yours did?
Yeah.
Okay. So we'll start.
They're not like deep breaths, are they?
Well, they should be. So think if you're doing a man twice your size, his lungs are way bigger than yours.
Yeah, true.
Now
We'll
babies are much
practice
smaller.
5 sets of 2 breaths along with the video. Get ready. Begin in 3, 2, 1.
Give 2 breaths. Watch for chest rise. Give 2 breaths. Give 2 breaths. Give 2 breaths.
I feel like your bag's too high, maybe.
And give 2 breaths.
Because look at hers, right?
They gotta be quick.
Well, you give a breath,
Let it.
wait like 2 seconds to give another breath. So you have 5 seconds. So you're gonna give that first breath, oh, maybe wait a second, and then give another one. Okay?
It's a little really hard.
Well, I can feel it going in there, I just,
You gotta press harder on the off.
not right.
There we go. Maybe it's not sealed.
Yeah,
too.
your seal is weird. Okay. Sit down for the next one. Then we'll practice.
Yes,
again.
ma'am.
The next one we're putting them together, I think. I paused it.
Now let's practice compressions and breaths together using your pocket mask with a one-way
So
valve.
it'll show you and then
When
you
switching
practice.
between giving compressions and breaths, limit the time between compression and breath cycles to less than 10 seconds. Make sure the chest rises with each breath, but provide ventilations just to the point of the chest rising. We'll start with assessment and then combine compressions and breaths. We'll be doing 3 sets of 30 compressions with 2 breaths.
We'll pause here to give you a moment to get into position with the mannequins.
So if you'd like to do it on the floor, that's fine. Oh, that's good.
I like the table. I need to go bed.
Yeah. All right.
Here we go. Begin in 3, 2, 1.
First, you check your sheen.
Hey, are you okay? Are you okay? Help, someone help.
Help! Good job.
Call for backup and get an AED. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14,
Go
15,
deeper, Casey.
16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Amber, what are you doing? Oh, shoot. Amber's died. Head tilt chin left.
1, 2, 3,
I was-
4, 5, 6, 7, 8,
It's
9,
okay.
10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, two, three, 4, 5, 6, 7, 8,
But
9,
not really.
10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Yeah, your seal just must not be quite right on that point. So I know you think he's fast. That was 1 minute.
It
So-
threw me off when I said-
100 compressions and 6 breaths. That's 1 minute. At the end of the class, you have to do it for 20.
Holy buckets.
I'm just kidding.
Oh, for real? We don't?
No.
Okay.
Not for 20, but imagine,
Yeah, I know, right?
you know, if you did it for a few
That'd be
minutes.
good practice, though. Yeah, that would
You'd all want to kill me.
Your abs will get a workout.
It really is a good workout. But even if you try and do it for 5 minutes, you see how tired you are. Obviously, like we said, you would have more adrenaline if this was a true emergency than when you're practicing.
You would have more.
But if you're from a smaller town, I mean, in Vermillion, how long can it take the ambulance to get there?
Yankton?
Or Yankton, sorry.
I don't know, 20 minutes?
Yeah. So if you're the only, say you're in the park, you're the only person there, you have to do that for 20 minutes. You can't stop because you're tired. She's like, ah, man.
I bet I got not CPS at that.